We're going to take you live to Queen's Park now, where Health Minister Sylvia Jones is making an announcement. Let's listen in.
A plan for connected and convenient care to further reduce wait times for surgeries and diagnostic procedures. Thank you for hosting us today, and especially to Drs. Patel and Shaw for all you do every day to help decrease diagnostic imaging wait times across Ontario. I also want to acknowledge and thank Leslie Thompson, CEO of Accreditation Canada, for joining us today. When it comes to surgical wait times, our government will not accept the legacy of years of inaction by the previous government that led to too many people waiting too long for care. Instead, we are taking bold action to expand community surgical and diagnostic centers so we can reduce wait times by doing more surgeries in state-of-the-art, convenient and safe facilities, which will always be paid for by your OHIP card, never a credit card. A key part of this plan is increasing the number of procedures that happen in our community surgical and diagnostic centers. For over 30 years, community surgical and diagnostic centers have been a part of Ontario's publicly funded healthcare system, providing a range of services covered by OHIP. And with more than 300 centers currently operating throughout the province. To build on the progress we've made through our Your Health plan and further connect Ontarians to timely surgical and diagnostic care, I am pleased to announce that beginning in spring of 2024, we will be expanding the number of licensed community surgical and diagnostic centers to deliver additional OHIP-insured services, including more MRI, and CT scans, GI endoscopies, and orthopedic surgeries. We've been clear all along that any expansion to community surgical and diagnostic centers must be thoughtful, and these centers should be held to the same accountability and standards to provide the same level of care as our hospitals. This is why I am also pleased to announce that today, our government is proposing changes that would name Accreditation Canada as the inspection body responsible for ensuring the highest quality standards and strong oversight of our current and future community surgical and diagnostic centers across Ontario, effective April 1st, 2024. We are very proud to partner with Accreditation Canada, who will lead the development of an enhanced oversight and quality assurance program that has the same strong requirements as public hospitals to ensure consistent patient safety and quality health care. They have been a national leader in this space for over 65 years, and we are grateful for their partnership as we move our plan forward. While we are just hitting the one-year mark since our Your Health announcement, we are making steady progress on the implementation of some key parts of our plan. A plan that is bold and innovative. A plan that is working. Under the leadership of Premier Ford, Ontario saw the shortest surgical wait times of any province in Canada in 2023, reducing the surgical wait list since its peak in March of 2022 and resulting in 16,000 fewer people waiting for the surgeries they need. We've also eliminated the backlog of surgical cancer screening tests at the end of August 2023. And we saw completion rates of pediatric surgeries reaching 112% pre-pandemic levels as of December 2023. And we are increasing diagnostic imaging capacity by an additional nearly 100,000 MRI and over 115,000 CT operating hours. These changes mean that Ontarians are getting earlier diagnosis and receiving treatment sooner so that they can get back to their regular lives with their families and their loved ones. The Liberals' inaction, supported by the NDP, led to the longest healthcare wait times in Ontario's histories. We must remember that they fired healthcare workers, froze healthcare funding, and cut medical school positions. Under Premier Ford's leadership, our government will continue to make bold and creative changes to build a healthcare system that works for you and your family. By working collaboratively with our partners across the health sector, we are making Ontario a place for people to conveniently connect to the care they need closer to home. Since 2018, we've added more than 80,000 nurses. with another 30,000 current nursing students studying in Ontario. We've added over 3,500 hospital beds, with another 3,000 on the way. And our changes have allowed pharmacists to do more than 650,000 common ailment assessments for people more conveniently closer to their homes. Thank you again to everyone across the healthcare sector and our incredible front care healthcare workers for helping to build a stronger, patient-centered healthcare system and ensuring Ontarians are provided with a better healthcare experience now and for decades to come. Thank you and stay well. It's now my pleasure to pass it over to Leslie from Accreditation Canada to say a few words.
Thank you, Minister. Thank you very much, Minister Jones and Dr. Patel.
All right, a big announcement in Mississauga this morning where the Deputy Premier and Health Minister Sylvia Jones speaking to reporters announcing that the Ford government is expanding its highly controversial private health care plan. She says more CT scans and MRIs will be offered in private clinics. You'll remember there was quite a bit of controversy, backlash to this when the Ford government first talked about it. So it'll be very interesting to see what the reaction today will be.